Today's case is a person with a bunch of missing upper teeth. Okay, and in this particular video about a case like this. Okay, so we'll focus today on dental implants as a solution for a case like this. Why? Because dental implants are a fixed solution with a pretty much high success rate, at least when you look at the evidence, and also high survival rate when you look at the evidence as well. Okay, and for a case like this, we have a bunch of problems that we need to address. Okay, so what is the first problem? Of course, clearly we have a bunch of missing teeth in the upper front region. Okay, that's very obvious to note. Number two, these missing teeth are in a very aesthetically demanding zone. Okay, so they are right in the front. Let me draw for you. Second, so they are in a very aesthetically demanding zone. Okay, this is problematic when it comes to treatment planning and dealing with a case like this, because the aesthetics and cosmetics are very important here. We need to match the shade and the color and the shape when it comes to doing the prosthetics, the crown part of this. Okay, so the shade needs to be matching with the rest of the teeth so that it would be aesthetically or cosmetically pleasing. The shapes of the teeth need to look really good, because anytime this person talks or smiles or etc., people are going to be able, or not going to be able, they're going to see the first thing, those teeth. So prosthetically, or from a prosthodontics perspective, this part could be a bit challenging, and we talked about some of the challenges. Okay, so it is in an aesthetic zone. Okay, everybody who's joining, double tap like on this. Please share this with your friends. Really help support the channel. This is how YouTube works. Okay, we need people to like, share this with their friends so it gets pushed to more people. Right, if you're new to the channel, my name is Dr. Mo and I'm a dentist. We're discussing this case for today. I'll take also Q&A, questions and answers later on in the video. I'll pick some comments from people. Okay. Okay, right. So we're focusing today on dental implants. There are, of course, alternative solutions, which I'll dive into in other videos. So it's not only dental implants, because dental implants, for some people, it could be not suitable, and I'll explain later on why. Also, some people may prefer alternative options. They don't want to go through a surgical procedure. That's fine and understandable. Some people simply don't have the budget for dental implants, and that is understandable too, because dental implants are for sure not cheap. Okay, in most countries, even people who go for dental tourism, they go to other countries for dental implants, they're still even not that cheap there. They may be cheaper relative to the US, for example, the USA, United States, something, but still, even other countries, it's not really that cheap to get dental implants. Okay, everyone? Right. So that dental implant, let's say if the person agrees with the operator about dental implant solution for this, they need to go through imaging to look at the bone underneath those gums, if it's suitable, if it can accommodate the dental implants. There's 3D scans, 3D imaging. Okay, like CBCT can help with the planning. There's software also that can help plan the dental implants, angulation and position, so it just helps to plan with the dental implants in general. Okay, there's now advanced software. There's something called as computer guided dental implant surgery, which I talk a lot about on my channel and on the stream, that will help for this procedure to be relatively safe and just to increase the predictability of the treatment. Okay, I told you this is very sensitive zone. It's an aesthetic zone. It will require someone who really knows what they're doing, who really knows how to deal with software. It will need really an excellent lab to make really beautiful crowns for to replace those missing teeth. Okay, because we have the dental implants part, the surgical part, and then we're gonna have crowns. Okay, so it's not only just dental implants inserted and that's it. Okay, welcome everyone who's joining. Nisha is here, says how are you? I'm doing great. What about you? Welcome everybody. Say hello in the chat. Okay, Right. So far, so good. Okay, so I told you. Okay, so if someone has very poor bone quality, very thin ridge, very thin bone ridge, that's where they have where it's going to be very challenging to accommodate the dental implants. These are not the most preferred cases for operators to do dental implants on. Really complicated, challenge it because there's minimum thickness of the bone itself to accommodate the dental implant. Because dental implant is actually quite thick. It looks small and thin, but in the context of teeth and the gums, the bone, it's relatively sizable. Okay. Remember, the tooth and the root, they're relatively small in size. Welcome everyone who's joining. Say hello in the chat. By the way, we have Nisha here joined. Other people joined, said hello. We're talking about this case for today. We're addressing it. We're talking about dental implants for this, okay? Yeah, the weather is good. It's actually raining a little bit. Thank you everyone who is asking. Everyone, don't forget to double tap, like in the stream, fix it. Yeah, the audio should be fixed completely right now. Fix the audio. It's fixed. Okay. So what about temporization? Now, after the dental implants are placed, there are temporary solutions, at least to have temporary teeth bare, at least for the appearance, because dental implants often take a long period of time until we reach the final solutions, the final prosthesis, the final crowns of the dental implants. Okay, so hopefully these things are very clear. I told you some challenges could be in relation to the budget. Dental implants can be expensive to some people, and that's understandable. There are other challenges in relation to this case being technically a bit challenging because the aesthetic zone is quite a sensitive zone to deal with, even for the operator and for the patients. They want something that looks really good at the end. Also, with regard to financials, it's relatively expensive to do dental implants. The dental implants aren't cheap, whether if it's in the United States or in other countries. It's not cheap. So there are some financials, budgeting issues that need to be taken into consideration. So aesthetic concerns, financial concerns. There are also technical, bone-related issues. Some people could have. Also medical diseases that make dental implants not the most appealing option, or at least until those medical diseases are managed or controlled. Maybe I'll make a separate video about this because it's quite a big topic. Okay, so the dental implant process itself can take up to months. There are techniques and ways to make the whole dental implant process shorter. I can address this in a separate video as well. There are alternative solutions to dental implants, such as dentures, like removable partial dentures. There are also alternative options, such as bridges, for those who don't want dental implants, or maybe dental implants are not suitable for them, or maybe they don't prefer to have a surgical procedure. Some people are scared a bit from surgical procedures. That is understandable too. Maybe they don't like the place being open. So yeah, there are more minimally invasive, like can reduce risk. I told you with computer-guided dental implant surgery, you can try to reduce risk, make the situation a bit easier. So you can research about digital dental implants or virtual planning in relation to dental implants. So there are more advanced methods in order to do this. So we're talking about this, obviously. Yeah, replacing here. Okay. And those alternative treatment solutions, also they have their own challenges. So I'll talk about each maybe separately in the future. So the bridge has its challenges and problems. The removable partial dentures, they have their own challenges and problems. So you can think about it more as like everything has own advantages and disadvantages. That's how people can look at it.